So a few things I've noticed in the news today that I think give us some aid in understanding the nature of the virus and what is going on. Friday the 14th of February. Now just before I do this, I'm going to deal with the most common question I get asked, and it's one of course I am utterly incapable of answering. Lots of people are emailing me saying I was exposed to such and such so many days ago, or I was exposed to someone from China, or I was exposed to someone who coughed all over me, I had a dry cough, I had a fever. Have I got the infection? Now, of course, I can't tell you that. Of course, I can't tell you that. I don't know if you've got COVID-19 infection or not. But what the advice is in my country, and it's very reasonable, sensible advice, is if you have a reasonable sort of criteria for thinking that you might be infected, then you should self-isolate at home, and as soon as you're home, pick up the telephone, and in my country we dial 111 and we'll be put through to a healthcare advisor, and if they're not able to answer our question, they'll escalate us onto someone who can, and we can be tested and dealt with appropriately. So it's nice getting all these emails. I'm sorry I don't have time to answer them all just now. I've gone from having about 2 emails a week to having about several thousand. But really, if you're worried about this, you have to get local professional healthcare advice. There's no other way to do that. And if they're worried about it, if you're in a westernised country, then they'll be able to test if the local doctors think there's reason to test. The key thing is, if you think there's a realistic chance you could have the infection, is to self-isolate and not pass it on to anyone else. If you're in a family and you share a family, if you've got a room, go into that room, shut yourself in it and phone from that room. And make sure the rest of the family pay meticulous attention to personal hygiene, hand washing and other things, as we looked at a couple of videos ago when we looked at how to protect yourself and your family. So get advice and don't spread it just in case is the summary of that. That's all the advice I can give you, really. Now, I've had a lot of questions about these. There was a sudden jump in the number of cases reported in China on the 12th of February. Why is this? Has things got dramatically worse in a day? Well, I've checked with the World Health Organization information on this. And apparently what has happened is that the Chinese authorities in Wuhan and Hubei province are low on testing kits for this PCR that we talked about in the last video. A bit of a complicated test. So what they're doing is they've broadened their diagnostic criteria. And the criteria they're now including is infiltrates in the lung on chest CT, computerized tomography, or a plain chest x-ray. They're including that as the diagnosis. So the diagnosis now in China is attributed if they have a positive PCR test, which is fine. And the diagnosis is also attributed if they have lung infiltrates on CT or chest x-ray to see that there's a consolidation in the lungs that would indicate the infection is there. And as well as that, they've applied this test retrospectively. So like if someone had infiltrates on the chest x-ray last week but was not diagnosed with the real-time polymerase chain reaction test, they're still counted as positive and they still go on the figures. That's why there was such a jump. It doesn't actually represent a change on the ground. Now, the other thing that caught my attention was Vietnam, of course, borders with China. There's a great deal of cross-border trade. And I did notice that several villages in the north of Vietnam, with several quite a large number of thousands of people in them, have been quarantined because of suspected cases, not that far from Hanoi in North Vietnam. So it does look like there's spread across the border, what you might call contiguous spread into Vietnam. Now this sinisterly fascinating story of the Diamond Princess in Yokohama The number of cases on that yesterday rose up to 218 infected cases. And what just gets to me is the Japanese government can't test everyone on the ship. I mean, the Japanese government don't seem to have the test kits to do this. It's really quite hard to explain, really. But that's what they're saying. Now, on these cruise ships, there's a lot of inside cabins. And even a lot of the outside cabins, the windows are sealed. You can't open the windows, at least in my experience, unless you pay a lot of money for a balcony, which not many people could afford. Most of the rooms are closed. So that means these people are dependent on air conditioning. And what we don't know, as far as I can tell today, and again, listening to the World Health Organization, no one knows if this is transmitted by aerosol in the air or just by droplet infection. But the fact that there's 218 cases on this ship now, I suspect, I don't know, that not all of them had it at the start of the quarantine period. I don't know. So is the disease being spread on the ship? It's a concern. It really is time the Japanese authorities had a good think about that and started getting these people off the ship to alternative quarantine, where they're actually quarantined from each other as well as from the rest of the Japanese population. Now, the Westerdam, the other cruise ship, remember this cruise ship that was bobbing around the high seas and no one would take it? It was turned away from various places. It was taken in by Cambodia. And I did mention I've done some work in Cambodia. The healthcare system there is basic. It can't cope with this extra demand. If there is an extra demand, they say the people on the Westerdam aren't sick. I do hope that's true. But things in Cambodia aren't always done as officially as you might like. So there may have been some unofficial procedures. Again, I had no idea. Hope not. But it could be that there's cases that are unreported from the Westerdam. It's possible. Positive news. They're now culturing the virus in Hong Kong. Sophisticated labs in Hong Kong. Because remember, the virus is an obligate intracellular parasite. It can only live inside cells. So the scientists and doctors in Hong Kong have worked out how to culture this inside cells. That means they can grow up the virus in any amount they want, and that's good for working on things like antibody tests and vaccine development. And bad news today is 1,700 healthcare workers infected in China. Terrible. Hopefully most of them will make a good recovery, unlike Dr. Lee. Many of them were probably infected early on in the epidemic, before as much PPE was available, personal protective equipment, and before their expertise in using it was as good. So hopefully that situation is now improving and less healthcare-acquired infection, what we used to call nosocomial infection, is occurring. Now, the NHS Chief Medical Officer today, he outlined 4 priorities. Contain the infection and delay it. Contain it and delay it, because hopefully the spread will be less bad in summer. Although Singapore is a lot hotter than England is in summer, and that's still got quite a lot of cases, so I'm not putting too much store by that. But if you can contain and delay, that allows time to get ready. And that's what he says. It allows more time for science and research, more time for research on antivirals that's going on in China at the moment. We don't know if any of the antivirals are effective. The Chinese are testing current antivirals to see if they're going to be effective. So 1, contain, 2, delay, 3, more time for science and research, and 4, more time for mitigation, getting the health service ready. Because if there's a lot of severe cases at the moment, we are not ready. If there's a large number of cases and a large number of those are severe, we are going to struggle. I do hope there's a seasonal rescue, that when it gets warmer, we'll have less cases, but we don't know that yet. And Imperial College London has done quite a bit of modelling on this, and they do say, I don't want to misquote them, so they don't say I'm misquoting them, but they say, as we've known for a while, it's possible we're in the early stages of a global pandemic of this. And if there is, which we hope there won't be, but if there was to be a global pandemic, that could affect 60% of the population, which is just huge. We hope there's not going to be a pandemic. But if there were to be a pandemic, 60% of people could be infected by that. Let's go on and do some... Now, I'll do another video for the figures because there's some difficulty with these videos, so I'm going to keep them fairly short. There's no ads on them anyway, so you can just click on them and they should play straight away.